start. All right, hello, I'm Natia Esiashvili, current president of PROS, and I'm very excited to announce that PROS is starting to archive conversations with our distinguished colleagues, which will be available on our website. It is my privilege and honor to interview the former first president of PROS and the founder of PROS, Professor Christian Carrie, who is joining me from his home in Lyon, France. Hello, Christian.
Hello, Natia.
Thank you for giving us this great opportunity.
Not at all. The honor is for me. I'm very proud to be the first interview for this new part of the PROS website.
Absolutely, and again, as a first president and founder, you definitely deserve to be first. And so we're delighted again for this opportunity, and I think many members would love to learn more about you. And let's start with your biography.
Yes, I will try to be short. So I was born. I was born the 15th of October in 1957 in Lyon, and I did all my scholarship and my medicine and my career in Lyon. And as far as I remember, I always wanted to become a medical doctor, despite the fact that nobody in my family was a physician. And the first part of my scholarity was quite no problem. And I started my medical school in 1975, just after what we call in France baccalaureate. I don't know if it's the same in USA. And at this time, when I started the medical school, the overall time to be a general practitioner was 7 years. And you had 4 years to be a resident. And during this period, you have to choose your specialty. And 2 years more to be a fellow and finalize your specialty. So I became a resident in 1982. But I started really in a hospital as a resident in 1993, because at this time in France, all boys above 18 have to do the 1 year in the army. So I did my army period in the helicopter regiment. It was a very good time with a very good friend. Well, it was nice to do helicopter. During the residency, I hesitated a long time between hematology, oncology, pediatric, or radiation oncology. And finally, I started my fellow period as radiation oncologist in 1987. My decision was due to the meet of two very important people for me. First was Jean-Pierre Gérard, and Jean-Pierre Gérard was the head of the Department of Radiation Oncology in Lyon. And at this time, he was also the president of the ESPOIR. And I spent two semesters in this department. It was very decisional for me. And the second person is Maud Brunner-Montini. Maud Brunner-Montini is not well known as Jean-Pierre Gérard, but she is the co-founder of the SIOP with Odile Schweisgood, Giulio D'Angio, and Berta Gireb. And she was the head of the Department of Paediatric Oncology, where I spent also 1 semester. And by deciding to be a radiation oncologist, I do also pediatric radiation oncology. And because the position was unfilled at this time, I was lucky to have directly the capacity to do that. At the end of my fellowship, I integrated definitively the Saint-Lambert in 1989. And I was again lucky because at this time, the director of the Center Saint-Lambert changed, and Thierry Philippe, one of my friends, was nominated. And he was also pediatrician, takes the place of Maud Brunner-Montini as head of the pediatric unit, and became also the president of the French Federation of Anti-Cancerous Center in France. So he asked me to be more and more involved in pediatric oncology. And I was nominated head of the Department of Radiation Oncology in 1992 because of confidence on theory and various local events. It's long and all his story. At this time, we were more or less 20 pediatric radiation oncology. It was not, we were not dedicated only to pediatric, and most of them were very, very young. We were, at this time, I was 35. And the French Society of Pediatric Oncology asked me to do a study on the pattern of relapse of medulloblastoma, because at this time we have had a lot of relapse in medulloblastoma, and we did this study and we found a correlation between the technique used to treat the patient with radiation oncology and the pattern of relapse. It was due to a wrong evaluation of the energy of an electron beam for the spinal axis. And we did the first paper in 1992, and it was the first of numerous papers we did all together on medulloblastoma with MSWAP 93, 98, 2007, and last 2 years ago with the hyperfractionated protocol. And we decided after the first paper to maintain this small French group, and we put on the way the workshop 1 time per year, and I think it was 2 times per year also we did the quality control for medulloblastoma. At the beginning it was with rapid courier, because it was not internet available everywhere, and now it is through internet. At this time also, at the same time, I integrate the group of brain tumor committee of the SIOP, and I met Rolf Kortmann. It was a very important rencontre for me, because Rolf became a very real good friend, and we work a lot in Europe with Rolf to organize the pediatric radiation oncology, and to organize also the quality control, and to involve the radiation oncologists in the RIT committee of all protocols where radiotherapy was useful in the treatment. And we were very quickly joined by Bill Timmerman, Karin Dickman, and Roger Taylor for UK. In 1994, yes, 1994, I spent 3 months in the Duke University, close to Ed Alperan, and the following year, 3 months also in the McGill University with Caroline Feeman, and both Ed and Caroline became also founder of the PROS with me, and a very good friend. And again, in the same period, it was a very active period for me at this time. I did a lobbying close to the French Health Ministry to recognize the pediatric radiation oncology as a specific specialties in the radiation oncology, to be paid more per treatment for children compared to adults, and also to define criteria for center ability to treat children or not. For example, in France, you cannot treat children if you treat less than 12 curative patients. Palliative is excluded, and TBI are excluded the total number. So in the same time in my hospital, not in the same time, just a little bit after, but I became the director of the technical department of the whole hospital. So that means director for nuclear medicine, radiology, endoscopy, and radiation oncology. And I became the CE of my hospital between 2009 and 2014. So regarding my private life, I think every member of PROS knows Sylvie, my wife. We are married since 40 years. The birthday was last week. And I am lucky father of 2 sons and 1 little son, age of 3. And for my hobbies, I like sailing, garden, bicycle, travel, fishing, guitar, You have the guitar there behind me, and looking for mushroom in the forest. And now I have more time to do all that. And next week I will go sailing probably.
Great. Maybe we should have had also play guitar for us. That would
Yes.
be a nice addition to this.
Well, not a good player. We say in French, I gratouille.
And I also know that you've been volunteering at COVID vaccination site recently.
Yes, since 1 month, I vaccine every day.
Great. Thank you, Christian. This was a wonderful story. So I would like to ask you about your vision about our society, which came together in 2003. And as you described, you've been creating these networks with pediatric radiation oncologists around the world. All the people you named obviously were in this core group, had that vision. And I just would like to know how this came together, like establishing of PROS. As you said, there are few radiation oncologists who treat children. And why do you think we needed our society?
First, I was not alone to have this idea. I think I am a member of the PSYOP since 1991. My first PSYOP, I think, was in Roma. And I did a presentation on tibia and zonal inspection. But I missed only two meetings of the PSYOP, Hanover, because it was leukemia, and Sao Paulo. And I was frustrated during this meeting because the small place of radiation oncology during the PSYOP meeting. And after discussion with Rolf, we decided to organize in Lyon the first International Congress of Pediatric Radiation Oncology. It was in June 2003. And we expected 20 or 50 participants, and in fact it was more than 200. It was a very big success. And it was evidence of a need and for everybody. It was the beginning of the story. The PROS was officially created in 2005 in Vancouver. I don't remember if you was in Vancouver. No, he was too young. And the first founder with me were Caroline Freeman, Sarah Donaldson, Roger Taylor, Patrick Thomas, Xiao Wu, Rolf Kortman, Edward Perrin, and Karen Godard. And all of it was something we say bizarre in English also, because all the scientific society in the world are on a national basis. You have the American Society of something, you have the European Society of something, you have the UK Society of something, or the French Society of Pediatric. But for PROS, not at all. PROS was thinking at the beginning as an international society because the need was the same everywhere in the world for all the pediatric radiation oncology. And the need for exchange for clinical cases, for example, but not only difficult case, because difficulty definition can change according to the place where you are. Your experience, your facility, the capacity of discussion of multidisciplinary staff or not, and with the PROS through the forum, even if we can do more and better, you have the possibility to discuss and to have answer your question within the 72 hours, even if it's not always the case. But and another thing, it was very important for me and my eyes, is to not cut the link with the PSYOP. We are not against the pediatric oncologist. We are close to the pediatric radiation oncology. It's very important to have a very good relationship with the PSYOP or with the COG. And we have now a joint meeting every 2 years and not our meeting across another 2 years. And I think it's a reason of the success, and we are, I think, very well seen in the board of the PSYOP. You can do the same consultation, I think. And I would like here also thanks package is now J11s, and their constant support, because at the beginning, when we created the first internal congress in Lyon in 2003, it was Thomas Garnier, and followed by Julia as PCO, Zoe Adams, and now Geraldine, who did a fantastic job for the pros and very close with me. So,
thank you. Yeah, I agree. I think, since, the beginning, organization of this pros like activities and everything was very well supported, and like you've outlined, interest was, pretty major from the very beginning, and it's only, continuing to grow. And we know that we have not only radiation oncologists, but medical physicists, therapists, nurses, all, allied specialists basically joining our ranks. And I would like to ask you, what would you tell people who are not currently PROS members, why they should consider joining us?
The first thing is, nowhere they will find such friendly relation between members as we have in PROS. And neither in Astro or Astro, you have a specific track for pediatric radiation oncology, or very small, one afternoon or two sessions on pediatric radiation oncology. And the only way to have a vision, to have an overview on technical aspect, also an update on pediatric disease protocol, is to be present during the PROS track, during the SIOP, and during the PROS meeting. It's not exclusive. And because, as I said previously, becoming a PROS member allow you to access to the forum. And even if I think we must change, we must improve this forum, a PROS member is never alone and can ask any question on the forum. And you have access also all the slides presented during our meeting.
Yeah, I agree. So I would also like to ask, now we're, we have like, we passed 15 years, since our society was established, and obviously had many successful activities. But what would you like to see? What, we still need to do in future to keep our members happy, engaged, provide, all the, resources, they're expecting from us?
I think to be a PROS member means also to be involved in the daily life of the society. That means to be present on the forum, to be present during the meeting, to make suggestions during the General Assembly, for example. And we are all responsible, the responsibility to make the PROS still alive. And I know you are very active with the subgroup of LMIC in the group, and I think the other subgroup must be as active you are. And for example, I would like to have on the PROS website guidelines, but not guidelines only for proton therapy, for example, because most of the PROS members don't have access to the proton therapy, but guidelines for how to treat medulloblastoma in low or medium income countries, for example. Perhaps we can make proposition. I did in the paper, for example, with HE40. It's probably easier to do HE40 for medulloblastoma than 1 year of chemotherapy and classic panospanine irradiation, probably less toxic and with the same overall survival. Regarding the future for the PROS, I think also that PROS can play a major role for the specialty. We must define minimal requirement, and from a point of view, how many cases you treat per year, for example. For me, it's not acceptable to treat only 2 or 3 children per year and say that you are pediatric radiation oncologist. What is the minimum number of dedicated physicists or technology? Do you have a specific track in your department for the pediatric? Do you have how you say that specific training and update of the knowledge, because the knowledge change very quickly in pediatric oncology. Do you have a multidisciplinary staff? This is what I say to be a minimal requirement to be a pediatric radiation department with a pediatric unit, a specific unit. And I'm sure if you improve the result, of course, we will decrease the number of centers allowed to treat children, but we must make lobbying action, and because I'm sure that parents would accept to treat their child far from their house if they are convinced that is the best for the children. And that means also we can ask for an involvement of authority to assure particular organizations such as housing, taking care of fratries when parents are away, and financial support. I think the quality of a cure children is very favorable and can justify to have more money to help the parents and to be able to move and to be housing close to the unit, proton or not, because all the children cannot be treated with proton.
Thank you, Christian. I think that's a great vision. Yeah, I mean, I agree. We have still quite a bit work left to do, for sure.
I don't know if I was clear on this last part, because it is difficult. The problem are not the same in every country, so we have to have a global vision for this organization.
Yeah, and like you said, being global society, that's our probably advantage to have good grasp on like diversity of this barriers. Different countries have different issues, different challenges to overcome, and our presence, like you pointed out, a strong presence amongst other stakeholders with other organizations for childhood cancer is definitely our best tool. And advocacy, like you said, is very powerful. And as a professional society, I think we should be very well represented in different settings where this advocacy makes difference at local, national level, as well as some of these international organizations. Some of the key decisions are made for, again, treating children. And like I've said, your role has been really substantial from the beginning, and you're still one of the most active members, I must say, like in forum or otherwise. I cannot imagine like a few days without communications and great support and advice and mentorship from you. And we hope to really have that going for many years. And like I've said, you're very active. You're I don't know how you do this all, but you're not only just doing our professional work and clinics and all of this, but
my hope is that you see me as long as you see Giulio D'Angio in the psyop. So it was 1908 when he passed. So I hope so, the same. And the pros meeting every year.
No, again, we wish for many, many more years to work together. And again, thank you so much, Christian. From really all of us, all of the PROS members, and even just think about so many families and children you've helped, and again, this is life's work. You should be very proud, and thank you again. This society is definitely it exists because of your vision. You're definitely one of the first people who had this idea and developed it, and like you named all of the distinguished colleagues, we're hopefully reaching out next, and hopefully they'll agree to give us their stories like you so generously shared with us today. And hopefully our members will learn, again, history always the foundation for future, and we hope this will only strengthen our society going forward. Thank you so much. Enjoy your Sunday. I wish you'll have good holidays coming up, and we'll be in touch.
And see you as soon as possible in real life, and not only through the web.
I agree. Hopefully we'll be recording real live, in-person interviews at some point, not just the Zoom meetings we've been having. So thank you again.
You are a very good president for the PROS.
Thank you, Christian. Thanks for your compliment.
Bye-bye.
Have a nice day. Goodbye.